were a lot of exciting advances in metastatic breast cancer research this year, particularly for those with estrogen receptor positive breast cancer. One of the most talked about presentations was the Destiny Breast 06 trial. Dr. Ballinger told us more about this trial and other trials that she was excited for people with metastatic estrogen receptor positive breast cancer.
I think the most impactful study presented at ASCO this year in breast cancer was probably the Destiny Breast 06 study. So this study used a drug called trastuzumab deruxtecan, or Enhertu, which is an antibody to the HER2 receptor on breast cancer cells. And then it has high doses of chemo attached to it that get delivered directly into the cancer cell. And we've previously had approval to use that drug for HER2 positive breast cancer and also HER2 negative breast cancers, like triple negative or hormone positive, that have a little bit of HER2 expression or HER2 low, but only in later lines of therapy. Destiny Breast 06 studied trastuzumab deruxtecan versus chemo after patients had progressed on endocrine therapy for hormone receptor. So this would be their first line of treatment. It improved progression-free survival over chemo, and there's a trend looking like with more follow-up, it's going to improve overall survival as well. So this is important for a couple of reasons. One is we can use the drug earlier now for patients for whom that's appropriate, but also the study looked at something called HER2 ultra low. So these would be tumors that were previously HER2 zero, no HER2 expression at all. But if there's even the tiniest bit, we now see that patients benefit. So this is almost 90% of the patients we see who are benefiting from this drug. And we need to work with our pathologists to figure out how to test for this well. And already this week, coming in the weeks off of ASCO, I've had to request multiple of my patients' tumors be retested for this. So I think it's going to impact a good majority of our patients with metastatic breast cancer. We also, I think in hormone receptor metastatic breast cancer, we have a lot more expanding options. At ASCO, we also heard the Innovo 120 study, which uses a drug called inavolisib that targets PIK3CA mutations in hormone receptor positive breast cancer. That was a positive study. So was post-MONARCH, which looks at patients continuing their CDK4/6 inhibitors after progression on a CDK4/6 inhibitor. So now we get more and more options for hormone receptor positive metastatic breast cancer, and we just have to work on how to sequence them and how to individualize kind of who needs what when.